Video ideas come to me in all different shapes and sizes, and this one came because I did a phone consultation with a lady from Florida who had some bad fat grafting about 15 years prior and was asking about whether I could suction it down. And the simple answer is yes. She had several consultations with other plastic surgeons who seemed to be a little bit scared to do it, and I will tell you it is actually pretty straightforward and easy to do. Unfortunately, as I told her, is I've actually had to correct some of my own patients because 10 years ago, I used to add fat into the anterior cheek, and the amount I added actually was incredibly small. A lot of my colleagues were placing 15 milliliters, and I have never, as far as I recall, put more than 2.5, and that would be even unusual. Most of my patients had about 1.5 milliliters. Very, very little into the anterior cheek. And to give you understand what 1.5 milliliters is, 1 milliliter is like a syringe of Restylane, and but fat is a little bit softer, so it's not 1-to-1. I would say probably it's 1-to-3, so it's almost like 1/3 of a syringe of Restylane. And 5 milliliters is equal to a teaspoon. So I used to use very, very small amounts in the anterior cheeks, but I've looked at my patients now 10 years later, and the one thing that bothers me is their anterior cheek. So if I've come back and I've done a facelift for them, or I've done more fat grafting, I insist on suctioning out the anterior cheek. So unfortunately, I do have quite a bit of experience with this. Now, I don't do this all the time. I do this probably once a year to twice a year, maybe at most. But I've never had a complication with it in 20 years, and it's very simple to do. So I do microliposuction of the face almost every week with a facelift. I've done 2 this week, as I've done 2 facelifts today and yesterday, and I've done microliposuction of their jowls. So I do facial liposuction quite often, but I don't usually do it for general overweight faces. I do it for very specific zones. If it's a buccal fat, for example, I would be removing the buccal fat because that's a deeper type of fat. But if it's a jowl or an overdone cheek, then microliposuction works very, very well. As a point of distinction, though, if someone's got a lump under their eyes, especially if it's firm, your best bet is to cut it out. It's much more targeted. So for under eye fat, if there's an excess, you want to make a small incision along the orbital rim, and it heals very, very well. Very, very difficult to see if you do it right. And I have unfortunately done that for not my patients, but other patients coming through. I've had one patient where I've had to do it on mine, a small incision here. And I've also done it for bad fillers like Artefill, Bellafill, and I have done that on my own patients. So I've had to make an incision there, but that heals very, very well. So if we're talking about jowls, which is just, that's not a correction, but if it's a overdone cheek or an overdone area and it's a subcutaneous plane, microliposuction works really, really well. What are the things that Dr. Google will tell you about it that makes you feel nervous about it? Well, they're going to tell you you're going to have contour irregularities, and I'll tell you I've never had one, both in the jowl and into the cheek area. And the simple reason why is that the technique is actually not that difficult. Where you have problems is if you use a liposuction cannula, like I'm harvesting in the body with a 3 millimeter cannula. That is very big, and that can cause problems. The other problem is you want to, just like when you're suctioning fat from the body, you're doing a cross-hatching technique that allows you, what I wrote in my textbook on fat grafting, if you slide the cannula in and then you twist it and you go back and forth in the same motion, you're going to over reduce an area and cause a deformity. So what you want to do is go all the way back, come this way, change direction. And if you do that, you simply should not see an overcorrection, like a deformity of an area being overdone. And then the cross-hatching technique and using a much, much smaller harvesting cannula, which I use a 1.2 millimeter cannula. So all of these things are the ways to avoid this. And as a side note, I'm going to do a video on this, is really understanding that the anterior cheek is fraught with problems. I highly encourage all of you guys to avoid using putting fat and fillers in the anterior cheek. And I see walking around town are cheeks and lips that look just god awful. And so it's about putting in areas that are not dynamically charged, like the anterior cheek just looks weird when you smile. Sorry, that's a quick aside. The point of this video is to talk about the safety of facial microliposuction and the indications of doing so and the indications of not doing so. Hopefully this video was helpful for you.